Okay. The last worksheet, I'm just going to leave this up for fun, I guess. So the last worksheet just kind of goes over the diseases and disorders, the respiratory system. It'll be like the first 2 pages, but the other pages have blood and cardiovascular diseases, so this will be, I just kind of explained it to you guys. It'll be kind of carried through. So the first one is pretty self-explanatory. We have sinusitis, which is inflammation of the sinuses. So whenever you see the word, I'm not going to erase this. I got to take a picture. The word itis always means inflammation. So whenever you, yeah, exactly. Inflammation. So that's what sinusitis means. Chronic bronchitis means bronchial thickening, and your bronchioles are the tubes of your lungs. So when the membrane of them gets thicker, that's bronchial thickening. That's bronchitis. And when it gets thicker, it also inflames. Emphysema. This is a fun one, not really. Destruction of the alveolar walls, loss of alveolar elasticity, diminished capillaries. So emphysema, is anybody squeamish? Is anybody what? Squeamish? Okay, well, cool. Emphysema, we're going to look that up. So emphysema, oh, yeah, that's what it looks like. And that's not good for your lungs. So it kind of like corrodes your lungs. Yeah, it's really nasty. Oh my God. Okay, let's go. Yeah, that's enough. So when you look at, oh, this is a nice one. So look at your nice alveoli in this one right up here. You like, oh, this is an emphysema alveoli. There we go, that's healthy. So usually alveoli are like a cluster of grapes, so to speak. So they have all this nice surface area, right? And so this is your alveoli, and they have capillaries around them. They have a nice surface area, healthy. And when emphysema comes, it causes them to like form together, so they don't have that surface area in the middle anymore. They just have everything around them, so it's not as much. So you have a diminished amount of oxygen going into your body. So that's kind of when those clusters of grapes kind of morph together, that's emphysema. And that's really, really, really bad. So emphysema, destruction of alveolar walls. This is something I know instructors like to talk about. So because it's so awful. So there's that. The next one, laryngitis, moving on, is just loss of voice. So laryngitis, like just say you go on a roller coaster and you scream a lot and your voice hurts, you can get that from laryngitis. Another thing too is if you get sick, you can also get laryngitis that way. So just loss of voice. I lost my voice, or if you sing too much. Bronchial asthma. This is the allergic reaction to allergens, such as when you inhale pollen. So when you breathe in pollen, you're getting asthma, or some people get asthma. That's bronchial asthma. It's an allergic reaction. So asthma, allergy. It's kind of when people are like, it's really bad. They start wheezing and everything. Oh God. So there's that. The next one, high altitude pulmonary edema. This is also known as severe altitude sickness. And this happens when you don't have enough oxygen and your body freaks out. Because
I ask you about this because I always like I've always liked that movie Vertical Limit. Have you ever seen that?
Vertical what?
Vertical Limit.
Vertical Limit.
It's a movie about people that climb Mount Everest. And a lot of people up there, they take medication with them because when they get to the high altitude, they can get pulmonary edema. And I was like, what is this? Because then on one section, one part of the movie, the guy's talking about it. And he's saying, well, basically her lungs filled with fluid and she drowned in her own body fluid is what he said.
Yeah.
Like, whoa, but what is it? Like, what happened? So
yeah.
I don't finally know.
Yeah, so it's like edema is like, so when you get edema, have you ever had a child? Pregnant people, how they get like edema in their ankles? It's just fluid buildup. Yeah. So that's pulmonary edema, fluid buildup in your lungs, so to speak. So this is like severe altitude sickness, and you get and some symptoms of it is like headache, vomiting, nausea, rapid heart rate and breathing, because your lungs are filling with fluid, like you said. So you're not breathing, there's less space for oxygen to bind to because of the fluid in your lungs. So you start like breathing faster to compensate for that, or try to, and then you die eventually, but unless you get treatment, right? So this also can lead to like hypoxia, vasoconstriction, and hypoxia means lack of oxygen. Vasoconstrictions in your veins, they kind of squeeze. They get smaller, and edema, which is like when you get that fluid buildup. So, anything else? Good? Okay. Carbon monoxide, this one's not fun, but toxic fumes from smoke. Car exhaust furnaces, carbon dioxide will bind to hemoglobin more readily than oxygen because carbon dioxide is a little more stickier, so it binds to your blood. But carbon dioxide will not dissociate easily, so it sticks stickier and it doesn't dissociate easily, and you can die from this. So we can die from all of this. That's great. So that's that. Do you guys have all of it? Okay. Disorders that impair gas. So this is all in your respiratory system overall. Disorders that are specific to gas exchange, though, is pneumonia, atelectasis, tuberculosis, or TB, also acute respiratory distress syndrome, also known as ARDS. So pneumonia is a lung infection, and this causes your alveoli to swell. So when your alveoli swell up, they get kind of puffy. This can lead to edema. A lot of the time, pneumonia can be caused by strep bacteria or Streptococcus pneumoniae bacteria and some viruses. So this, when your alveoli expand, you also lose surface area because they kind of expand into each other. So it's a bad thing with pneumonia. So, and you get fever and everything. Any questions on pneumonia? No? Okay. Atelectasis is also known as a lung collapse. This happens when your blood vessel collapses with your lung. Alveoli collapse, and this can be caused by a pneumothorax, a hemothorax, or a ruptured pleura. So basically, be caused by, whatever. I'm sorry. There you go. I can't. There you are. So a pneumothorax is like if you get air in your lungs. That shouldn't. So just you get a stab wound, and air goes into your lungs. Well, that breaches the boundary of the atmosphere, everything. So air will just flow right in, and basically it'll flow right through you. So you won't breathe. It'll go into that stab wound, and out through your lungs, or into your mouth and out through the wound. So you don't actually breathe. Air will just circulate through you. So when that happens, and that pressure is compromised, your lung will like just elastic recoil up, like I don't know how else to say it. It'll just scrunch up. So that happens sometimes. Another thing is a hemothorax, which is if you get another stab wound and blood gets in there and compromises that pressure, or ruptured pleura, and a pleura is the membrane. So if like your lungs rupture, then that also compensates pressure or complicates the pressure because you have that cavity around your lungs too, and it'll not be maintained. And so it's atelectasis, when your lungs collapse and they kind of like fold in on each other. So think about a building kind of like falling and collapsing. That's kind of what happens to your lungs. TB, also known as tuberculosis, is a bacterial lung infection from Mycobacterium tuberculosis. So hint, hint, the bacteria is in the name of the disease, and the formation of tubercles around infections. Respiratory membrane thickens, lung tissue is destroyed, surface area for gas exchange is reduced. Just like that. So let's look up pictures of tubercles. Tubercles. Okay, well, I'm not seeing what I want to see, so I'm not going to go venturing any much longer. So acute respiratory distress syndrome, This happens a lot in premature babies, unfortunately, but basically their alveoli collapse. So alveoli collapses. The blood vessels in the airway narrow, so everything gets a little bit tighter. And then oxygen delivery is repaired, so they don't get oxygen circulated to them. And then another thing, too, is their lungs don't inflate. So this is also known as ARDS, acute respiratory distress syndrome. So I just think of like distressed babies, and I feel really sad, but that's what it is. So the last top box is respiratory. The bottom one is blood. We'll be covering that, I think, maybe next week or the week after. So pleurisy. 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 There you go. It's a funny way. This is inflation of the pleura due to infection, lack of serous fluid, because the cells are infected. And if you lack that serous fluid, remember we were talking about how your lungs kind of could rub up against each other. We like those type 2 septal cells because they produce surfactant in the alveoli.